Hi, hello. My name is Muhammad Harith bin Roslani. Okay, this is our group. We will present about the Do Not Resuscitate, the DNR. Okay, our group member is me, myself, Harith, Syamimi, Farah, and Joseph. Okay, next. Table of content. Okay, I will explain about the introduction. And then the others will be explained by the others member. Okay, as for the introduction, okay, this is the definition of the DNR, do not resuscitate. Okay, do not resuscitate is a legal order typically written in a hospital setting or the medical setting that instruct the healthcare provider not to perform the cardiopulmonary resuscitation, which is the CPR. Okay, if a patient breathing stop or if the patient heartbeat stop. Okay, the DNR order is specific decision made by a patient or their healthcare proxy, reflecting the patient wishes about the end of life care and is part of the larger advanced directive plan. Okay, the decision to implement the DNR order involve careful consideration and discussion between the patient and their family, and also include the healthcare provider. It's crucial that this decision is based on the patient values, preference, and understanding of their medical condition. So to do this DNR, we need the patient decision also or their family members decision, and we need to highlight the or understanding the patient medical condition. Okay, next. Okay, next is the types of the DNR. Okay, there are 6 types of DNR. Okay, first is the pre-hospital DNR. Okay, this type is intended for use outside of the hospital setting. It instructs emergency medical service not to perform CPR if the patient is found outside of the medical setting like hospital. Okay, next is the in-hospital DNR. This DNR order applies to patients who are already hospitalized. It directs hospital staff not to perform the CPR. So this patient already in the hospital and the staff in the hospital cannot do the CPR if the patient requests for the DNR. Okay, next is the DNR by the patient choice. Okay, this is a voluntary decision made by the competent patient who are understanding their medical problem. So the patient itself make their decision to do the DNR by the patient itself understanding what is their medical condition. So they agree to do the DNR. Okay, number 4 is the DNR by the surrogate decision. Okay, this type of DNR actually when the patient do not have the ability to make their own decision. So the family members or other relative can make the decision for the patient. Okay, next. Okay, number 5 is the DNR by physician order. In some cases, the patient is unable to make decision and there is no family member, there is no surrogate available. A physician, meaning a doctor, may be placed a DNR order based on a medical judgment and ethical consideration, particularly when CPR is deemed futile or it will not align with the patient expected quality of life. So it's based on the physician decision under the medical condition circumstances. Okay, next is the conditional DNR. Okay, this type allow for CPR under specific condition. For instance, a patient might want CPR if the likelihood of a good outcome is high, but not in cases where the survival would result in significant disability or suffering. So this mostly when conditional meaning if the patient have the can cure or have the what we call it have a chance to cure. So DNR cannot be due on this patient if the patient not have the chance to cure or have the disability if they continue with the treatment. So the DNR can be applied to this patient. Okay, I think that's all from me. Okay, next.
Okay, hello everyone. So now I'm going to explain about, I'm going to relate the DNR with the ethical and medical ethical and professionalism. So ethically, the decision is to implant the DNR order is guided by respect of the patient autonomy. As you can see, the slide first will be the patient autonomy, which means patient have the full rights to know what are the treatment they are going through and what are the procedure they are going through. So medical healthcare professional always will explain to the patient, and patient have the full rights to make a decision on their treatment. So next we can see the beneficent and non-beneficent. This is will go under the medical ethics, where the GMP, the knowledge of good medical practice, will come to not harm the patient. Next is communication and decision making. So communication and decision making is under professionalism. Communication decision making very crucial because the healthcare and the medical officer need to communicate with the patient and their families. So shared decision making involves collaboration discussion to ensure that the patient values is aligned, and they will understand what they are going through and what the treatment they are going through. So next slide, please. Okay. Next will be the informed consent. So in medical ethics, informed consent is very crucial principle that emphasize the importance of the patient autonomy and right to make decision about their own healthcare. So it involves providing the patient with relevant information about their condition, treatment option, and the potential risk and benefit that patient are going to get through. So the patient must fully understand this information about their self before going through or agreeing or refusing a medical intervention. So this process of obtaining informed consents typically includes a discussion between the healthcare provider and the patient. Next will be the legal and regulatory compliance. So legal and regulatory compliance in medical ethics refers to laws and standards that govern the practice of medicine. So this is to ensure of the well-being of the patient and the integrity of a healthcare professional. So this includes following guidelines set by the medical boards, government health guidelines, and relevant legalizations. So compliance often involve issues like patient's confidentiality, informed consent, proper documentation, and professional codes of conduct. So it serves to protect both patients and healthcare providers, so maintaining a foundation, trust, and ethical conduct within the medical field. So that's all from me.
Okay, so I'll be talking about the legality and practice of DNR in Malaysia and also in other countries. Okay, so first I'll talk about in Malaysia. So in Malaysia, the Medical Act 1971 governs medical practice. Do not resuscitation DNR orders are generally not legally recognized. So we can say that there's no really a current state of where Malaysia is between accepting DNR or not. So, however, in certain cases, doctors can consider withholding the resuscitation of efforts based on the patient's previously expressed wishes, or if they believe it's medically futile. So it's not like again, Malaysia is not really like something that does not really support DNR. However, it can be considered with certain advices. So nonetheless, the legal status and implementation of DNR orders can vary based on the hospital policies or maybe the specific circumstances itself. So a patient's right to refuse the treatment is also recognized by the Malaysian Medical Council, or MMC, in its guideline, which is the consent for treatment of patients by registered medical practitioners. So the purpose to clause 17 of the guideline is that every individual is entitled to refuse any medical treatment regardless of the reasons for making the choices, whether they are rational, irrational, unknown, or even non-existent. So in this case, we can say that how Malaysia, they actually take on both parties, like the doctors and patients, where they will listen from the patient side and also towards the best decisions that the doctor can make. So that is for Malaysia. Next slide, please. So however, in other countries, or maybe specifically in other developing countries, they actually can accept DNR practice in their countries. So one of it is actually UK. So in the United Kingdom, the national guideline regarding the do not attempt cardiopulmonary resuscitation, or also known as DNA CPR, is accepted, and they are provided with the guideline by the Resuscitation Council UK or RCUK. So the guideline is quite general as to what are the countries that does DNR practice to. Is quite similar to this. So the first is decision-making process. So in this guideline, they actually emphasize the importance of involving patients or their representative in the discussion about CPR and also DNA CPR decision. So the healthcare providers, they should also provide a very clear, understandable information to help the individual to make the best choices or informed choices that they can make. The second part is the assessments and also documentation. So in this guideline, they can actually stress the importance of respecting patients' autonomy and their wishes regarding the CPR. The third guideline, or maybe the third step in the practice of DNR, is to respect the patient wishes. So the guidelines stress the importance of respecting patients' autonomy and their wishes regarding CPR. So in step 2 and step 3, we can see that how this also relates with the principle of medical ethics in doctors. And the fourth step is the regular review. So DNA CPR decision should be reviewed regularly, which means that if there are any changes in the patient's condition or maybe preferences, should be discussed with the doctors and should be once again be realized about what the patients want the best for them. So next. Yes. Also, like for other countries that actually accept DNR practice are like United States or maybe Canada, Australia, Germany, and also an Asian country is like Japan. So if there are also development countries that accept DNR, there are also countries that may not accept DNR practice. But if there is any country that accept DNR practice, from what we can say is that there are no specific countries or maybe a list of countries that actually had stated officially that they do not accept DNR practice. So there's no region or any healthcare system that say so. So some region or countries, they may not specify it in law or any guideline addressing the DNR or this, which can make it challenging for the individuals to formally document their preferences regarding the resuscitation. So this is maybe due to terminally ill different cultural backgrounds between the Western and Eastern countries, especially like in countries like Asian, like Korea, China, and Japan. They have a very family-oriented Confucian culture, and many of these patients prefer to consider the best of interests of all family members. So this means that in like Asian cultures and Asian countries, making a decision about withholding or withdraw the life-sustaining treatment for a family member is considered quite unaffectionate for them. So it's quite difficult for them to make a stand about it. So despite of all of these stereotypes regarding the Asian countries on the DNR practice, Japan has been the first country or maybe Asian country that had been stated its stand with the DNR practice. So even though there's no official guideline about the DNR or this from Japan, it was the first Asian country to actually address the death with dignity as the act of withdrawing or withholding all life-prolonging measures on the basis of patient wishes. So this could mean that it is the first step for an Asian countries to stand with DNR practice. And there's also countries like mainland in China where there's no formal legalization. However, in clinical practice, there is a risk of cardiac or maybe respiratory attack, and these physicians will inform the patient's family of the poor prognosis. So the patient surrogates are then asked to sign their consent on indicate whether the patients accept any invasive treatment like endotracheal intubation, and if they refuse to take the treatment, it could be considered as DNR order. So that is how most Asian countries would see the DNR practice or DNR orders being taken from the healthcare system itself. So yeah, that's all from me.
Okay, so next is the scenario of ethical dilemma in handling a do not resuscitate DNR order, where in a hospital setting, I have choose a scenario based on in a hospital setting, there is a patient with a history of chronic illness and is admitted to the ICU due to the severe deterioration in their heart. So the patient is conscious but is struggling to breathe and it is in significant distress. So the medical team, including attending physician and the nursing staff, has been providing aggressive treatment to stabilize the patient condition. And although they also help the patient to ease their to make their comfort, but however the patient health continue to decline, and then the medical teams already did their discussion, and they believe that the patient may benefit from do not resuscitate order because the patient cannot be safe anymore. So the attending physician discussed the option of a DNR order with the patient and their family after that, and then of course, the physician has to need to explain the DNR order, which means that if the patient heart were to stop or if they were to stop breathing, CPR will not administered. So the physician emphasized that the focus of care would shift to providing comfort and alleviating suffering. So the patient and their family are very hesitant and they express the concern about implication of DNR order. They feel like they cannot let go their family member and they are worried that it will mean they will giving up on their family member, which is the patient, and then they are not unsure which is the best course of the action, and then some of them even not agree about this case. So that's is the action. Wait. What is the healthcare worker action where uh, the attending physician should discuss the wait the medical team need to provide the transparent and compassionate communication to the patient family by acknowledging the error and its impact on the patient care and dignity. So it's like the medical team has to give the truth, have to deliver everything about the condition of the patient, which is the best what is the best for them, what is not good for them, because sometimes the limits of a patient is actually sometimes patient has to apply a DNR because it has reached their limits of life, because sometimes they cannot do anything, they just rely on the uh life 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 technology, because they have to breathe with the machines and a lifelong machine. So it's very when in a long time duration the machine will cause harm more than a treatment itself to the patient. So sometimes the doctor makes the decision based on that. So the healthcare team also including the nursing staff, the attending physician and the hospital ethics committee must also ensure that the patient's subsequent care align with their original DNR wishes and focuses on providing comfort and support. So rather than we want to let the life be, we actually wants to alleviate the pain of and suffering of the patient, because laying in the bed for a long duration time is will cause more damage to the patient itself, and then also cause the damage it will cause higher pricey price to the patient family also. And the next is the respect for patient autonomy is very paramount. So this may involve exploring the patient values, belief, and preference to align decision with their individual perspective on and off life care. So in this case, if the family patient does not want to give the uh uh to give the keizinan untuk for 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 their family patient to do not resuscitate order due to the religious aspect. So we have to respect it. So as a doctor, as a medical team, as a healthcare worker, we need to respect it. But before that, we have to tell them it's the best for the patient, it's the best for their family, and tell them what is the negative effects of the patient if they lay in the bed for a long duration without any further improvement of their life. And then if they still want their patient's family, their family, which is the patient, to receive the treatment and do not give the DNR order. So as a medical doctor, we have to document all the discussion and decision truly in the patient medical record, which is the number 5. So we have to make their family member to sign a documentation that they ask the doctor medical team to do not DNR order. So, but if they agree to do that, also they need to sign a documentation about DNR, so that if anything happen in the future, they will have a proof that say the family members already signed that contract. So, lastly, I think it's a provide emotional support. So we need, as a medical healthcare worker, we need to have the empathy. We have to understand. We have to put our shoes in their shoes. So we have to become more. We have to the empathy quality. We need to have the empathy quality so that when we do our task, we appreciate every life. So we didn't feel like every patient is a burden or anything. So we just feel like it's like one of our family members in that situation. So we have to provide the emotional support, and then offer empathy support and acknowledge the difficulty of the decision that they are facing, and ensure the emotional and psychological support service such as counseling to the family member, and available to help that are available to help the family to cope with the challenging circumstances. And also, we have also to, as a medical doctor, they need to collaborate closely with the nursing staff. So we need to advocate them, involve them in the discussion with the patient and family, ensuring that they provide the continuous support and address any concern or question that may arise. So I think last, regularly assess the patient condition and the appropriateness of the DNR order. So as in the code of Hippocratic oaths, there are sentences that say we need to do anything to save a patient life, including the preventative or treatment. So we need to find another alternative like palliative care or something that can be given to the patient in order to prevent the DNR order. So if the doctor cannot find any palliative care that are suitable for the patient, and the only way to alleviate the pain and to comfort the patient is through the DNR order. So I think that's the final decision that can be made by the doctor. So next is the overall objective that can be get throughout this presentation, which is it's loading. Okay. Which is the student should articulate a clear definition of do not resuscitate and understand its significance, such as what Harith said earlier. And the students should explore the ethical principle underlying the DNR decision, including autonomy, beneficence, non-maleficence, and justice, what Joseph said earlier. And then the third one is understand the legal aspect of the DNR order, including the documentation process, patient capacity, and role of advance directive. And then next is examine the concept of patient autonomy in the context of DNR decision, considering the patient right, informed consent, and share the decision making. So as I said earlier, they need to share the decision making with the other medical team, and then they need to consider the patient rights from the religion or other consequences, and then inform concerns, and then assess the concept of medical futility and its role in determining in determining appropriateness of resuscitative measure in the specific clinical situation, analyze the impact of family dynamic on DNR decision, considering communication challenges, conflicts, and the importance of involving family in decision-making process, such as what I said earlier. And then the student should discuss the responsibility of healthcare professionals in conveying DNR information, facilitating discussion and respecting patient wishes while adhering to ethical guidelines. And then next, recognize the emotional and psychological challenges associated with our decision for patient, family, and even healthcare provider, and explore the strategy for providing support. And lastly is develop practical skill in engaging with patient and family to navigate the DNR discussion, ensuring the compassionate and informed decision making aligned with ethical principle. So I think that's all from us. Thank you. Harith, do you want to do the conclusion?
Okay, as for the conclusion, so this DNR is we need to see all the consequences from many aspects such as the medical ethical. We need to see all those aspects before we make the decision for the DNR. We need also to hold the patient rights, and we need the informed consent from the patient if they want to do the DNR. Also, the patient also need to have the deeper understanding before they make the decision of the DNR. Okay, I think that's all from us, and thank you.